Hi, I'm Johnny Benjamin. Just before I was diagnosed with schizoaffective disorder, I reached the point of a mental health crisis. To find out what exactly a mental health crisis is, and what you can do if you find yourself in one, I've been talking with Dr Ranj Singh. So what is a mental health crisis?
A crisis is any point where your mental health worsens to an extent where you either need additional or urgent help. And you might not have a diagnosed mental health problem, it's just got to a point where things have got out of control. And there's kind of different kinds of mental health crisis. You might be experiencing suicidal ideas or behaviour. You might have psychotic symptoms where you kind of, I suppose, lose your touch or your grip on reality. You might have extreme anxiety or panic attacks, or any other kind of behaviour that's out of control. The important thing is that whilst a crisis is scary and terrifying for most people and those around them, it can actually be a turning point, because it might sometimes, unfortunately, need a crisis for you to think, I need to get help, or whatever I'm on isn't working. And if it's handled the right way, it can be a really positive experience, it can be a positive outcome to it, but it has to be dealt with the right way. The important thing is that when you have a crisis, you've got to tell someone and you've got to seek out help.
What can you immediately do if you're having a mental health crisis?
And the really, the crux of it is that you've got to speak up. You've got to ask for help. You've got to a point where you can't handle things by yourself. And that help might come from people around you. So your support network, your friends and family. It might come from an advisory or an advice service. So you might call someone. So like a specific helpline, NHS 111, or the Samaritans or the Mind helplines. They may or may not be able to help you at that point. Or you might want to seek out a professional service. So for instance, a community mental health team, a crisis team, your GP or A&E. Whichever help you go to may not be able to sort you out entirely, but they should also be able to point you in the right direction if you need extra care. Now, some people, if they experience this frequently or a lot, they plan in advance. So they might make up something called a crisis card. So that's a little card that sits in your wallet, and on that it says, it's an instruction to yourself to say, basically, this is the person you need to call, this is the place you need to go, and if I'm in a crisis, this is what I want to happen to me. That's a really useful thing to have, just because in that moment you're not going to be potentially thinking, like you normally do, or thinking straight, and you just need something quick and easy to go to.